I am so glad to be here and really excited about this opportunity. So I love that all of you are here. That means you want to learn and yeah, continue to get more information regarding whatever topic in mental health. And I think that says a lot about you. So thanks for taking the time. We will talk about a couple things today. Some of the objectives are to look at the treatment scaffold as the title for teen anxiety. And I'll kind of talk about that a little bit. And then I want to teach ways to improve, getting a more solid diagnosis and what differential diagnoses to look at, and learn how medication and behavioral techniques can aid in reducing that anxiety. So we will cover all sorts of things. We'll be covering good sleep hygiene, why that is important, nutrition, movement or exercise, but I term it as movement a lot. And we'll also cover, as I said, medications, some of them, just briefly. I won't get too deep into that, but I think it's good for people to have an understanding in case someone has tried a medication and then they swear off all medications. They can have a real benefit when needed. So the prevalence, many of you know probably that there were 2 national surveys and over 10,000 adolescents ages 13 to 17 showed that the 12-month prevalence of anxiety disorders in adolescents was about 25%. And this is covering, there's so many anxiety disorders. There's obviously generalized anxiety disorder, and this one, females had a higher rate of anxiety of that disorder, 2.4%, and males were at 1%. There's social anxiety disorder. This one comes in a lot higher in the teen age range. And so of those 10,000 adolescents, about 15.5% females had social anxiety and about 11% among males. And I would say that's growing just with all of the social media, all of the comparison. They're always not even social media, just having access to the phone that can take pictures all of the time and comparing and staring at themselves in all these pictures. That can be hard for a teen girl and a teen young man, actually. There's phobias, there's separation anxiety disorder. So the lifetime prevalence is about 4%, and then there's other associated behaviors with these anxiety disorders, one of which I'm sure many of you are familiar hearing from patients or students you work with, that there's the school refusal behavior. And I see so many that have that school refusal, they just can't get there. And underlying that often is anxiety, if it be that social anxiety or generalized anxiety disorder. And so that's important to look at so we can treat that and get them back to school, because the longer they stay away from it, the bigger the problem rises, right? It snowballs into a bigger problem. There's, of course, comorbidity with anxiety disorders. So limited research suggests that children with an anxiety disorder have an increased likelihood of being diagnosed with a second anxiety disorder or multiple disorders. And study of, hundreds of youth found that social anxiety disorder, generalized anxiety disorder, and separation anxiety disorder co-occurred in nearly 60%. So they're just really closely combined and often like to hang out together. Studies have found that generalized anxiety disorder and social phobia were the most strongly linked to depression in youth, because they feel that anxiety and then that leads to those depressive symptoms. They don't want to feel anxious, and so they will, start with staying home from school, and then they're getting behind, and then they're feeling less than, and it just snowballs into depression. And ADHD often co-occurs, and I see that so much, and that can be a big issue. And we'll talk more about that. So with the comorbidity, how to look at teen anxiety versus ADHD. Anxiety can be caused by underlying ADHD that is untreated. So a lot of people come in and they say, I have ADHD, or the parents come in and they bring in their teen and, they say, um, I have, I have anxiety. And so, or they've come, from being treated somewhere and they're treated for anxiety. And underneath that, when you dig and look, ADHD is often the underlying cause. And that anxiety stems from, say they are a teen, their backpack is just a disaster, they're stuffing stuff in, and they can't seem to get their classes or classwork organized. That causes anxiety. Or they come to class and they have time blindness, so they have forgotten that there's a big exam that day and they haven't studied. That causes anxiety. Where if they could just get the underlying ADHD treated, that could be helpful. So like I said, symptoms of anxiety can look like symptoms of ADHD. And so that does get missed a lot of times. So how do we distinguish which one is it? Because they do or do they have both? Because that's common as well. And so I'm sure most of you have used or have seen or filled out, if you're a teacher, assessments like the Vanderbilt, where, we send the Vanderbilt assessment scale home to parent and also to teacher, and they fill it out. Now, this is not a standalone assessment where if they don't mark, like if the teacher one comes back that they're a perfect student in class, that doesn't mean they don't have ADHD. We don't just take those and say, oh, okay, well, it looks like you don't have it because you only have some difficulty at home. They might rein it in at school. A lot of kids can keep it together. Many can't, and they're up out of their seat, but some, especially girls, are good at masking in the younger into early teen ages where they can sit there and they do get their work done. They're more of the daydreamer type, but they aren't noticed by peers and teachers to have the hyperactivity component, so they get missed. I will say when teen girls, well, when puberty hits, that's a lot of times when the missed girls in the younger ages will manifest symptoms, and that's when they get diagnosed, because puberty and the change in hormones often brings out some of these, and also difficulty in classes, right? That's junior high. They have a lot more to manage and classes get harder. So we do their self-report. We send home these Vanderbilt assessments, and their self-report. We ask how things are going at home. We ask how things are going at school, and look for things there that are causing trouble. How are relationships? And then there's also the QB test that we look at, which is an FDA cleared test. It's not a standalone test. So again, they don't take the test, and then if they have the pattern that it is ADHD, we don't say, okay, you have ADHD. We have to listen to their subjective data and gather that information as well from the parents and the teen and see how things are going. So this one, I just love how this shows at the bottom the age, how, the age range of well, teens. Look at most of them are hitting or starting in the teen years or peaking with the anxiety disorders. And this is kind of the median age of onset for different psychiatric disorders. And I love seeing this because, as you can see, ADHD and conduct issues start a little before the anxiety disorders come in. But yeah, they both have quite a peak in those preteen years. So that's important. And we also know that when anxiety is not treated, and this is something that's so difficult because there's such a stigma. So if anyone has a fix for reducing stigma, please tell me your secret, because that's what's hard. A lot of parents, that one of the biggest things I hear is, how do I get my teen to come in for treatment? How do I get them on board to not make them feel like they're so different? And teens don't want to be different. They're already, trying to find themselves in junior high. That's hard. And so What happens though with untreated ADHD or anxiety, or depression for that matter, is the substance use starts to creep in, as you can see, around 15 years, old, sometimes sooner, to try to feel better. They are grasping to feel better and find something that can help them. And so it's important to get get people to come in, get diagnosed, get help, get into therapy, so that they don't go down that path, that very dangerous path. I will also say, I don't have a slide on this, but another common issue that comes into play that isn't on here are eating disorders. And underlying eating disorders is anxiety. So that needs to be looked at as well and ruled out, because they are doing those behaviors, binging, purging, restricting, to keep control of the emotional instability. It's not always anxiety. There's, a lot of other things that can spark that, but that's important also to look into, because early treatment of eating disorders greatly affects the outcome and success and keeping those patients alive, because there's such a high, sadly, mortality rate with eating disorders. It's the highest one. So I did mention, for distinguishing how to diagnose and how to get a really clear diagnosis, one thing we do use at LEVO is the QB test. So I said it's an FDA cleared computer test. So as you can see, they can do it at home. Most choose to come in and they will have a clicker in their hand, and the thing on the band on the forehead tracks movement. It tracks kind of your facial movement. And it really is a computer test. So it's 15 minutes or 20 minutes, depending on the age. And they sit there and it's really boring. We hear a lot of complaints that it's super boring, but it helps. What is interesting is it breaks down the symptoms of the inattention, impulsivity, and hyperactivity to see what is going on. Can we see patterns that are ADHD? And actually, we can see patterns. We don't usually recommend it if someone comes in just with anxiety. We have to see if the subjective data is leaning toward ADHD, but sometimes when it sounds like ADHD and we have them take the test, it can show patterns of anxiety as well. So we're able to say, this looks more like anxiety. I think something to treat the anxiety, or getting into therapy first. Let's try that, depending on how severe. And then that's helpful information. I've had several patients in tears over this, because they can see what is happening in their brain, and they know and can finally see that they're not lazy. All the stuff they've heard, right? They're not applying themselves. They're not dumb. It's powerful to get a diagnosis. I love talking about the biopsychosocial model, which I'm sure all of you are familiar with. But why I love this is because mental health isn't just about therapy, or which is, the psychological is what are our beliefs and emotions and coping skills. That is a huge part. But the biological, which is where LEVO sits, I mean, we do, as it says in the middle, intersect all of them, because we look at LEVO the physical health, neurochemistry, genetic. What we do with genetic testing is which meds will work for people, which won't. Now, we can't know for sure if they'll work, but what can they metabolize better than some with the gene site test? And hormone therapy is huge. We don't do that for teens. We don't do when someone's transitioning or anything like that. But as people get older, we do look at hormones, because that plays a big role. What stresses do they have in life? Is the teen overscheduled? That can be hard, especially in our society with everything being so fast paced, and there's just so much available at the, hit of a button on our phones. And texting. There's just so much involved for these teens being online, and those that do have social media. I just always warn to be so careful, because no one should be accessible to friends 24/7. When most of us probably grew up, right? We didn't have the cell phones yet. We didn't have access, or people didn't have access to us all the time. And we had that downtime to be able to reset, refresh, not take home the worries of school home, hopefully, and be able to have a minute. And a lot just don't have that. And that causes more anxiety as well. Also, what is at the social, what is in their social circle? Do they have support? Do they have peer relationships? How is that going? Or do they have that social anxiety and start to, retreat and, I don't know, turn to drugs and alcohol or get depressed? So I just love that being in the intersection of this. Oh, another thing I love to look at in my practice and at LEVO, we all love to do lab work, which isn't always traditional in a mental health setting because we like to look at vitamin D. Now, that doesn't necessarily cause anxiety, but it causes depression, which then could cause anxiety if you can't, get out the door to do things you enjoy. So looking at vitamin D, vitamin B levels, that kind of stuff, how's their thyroid function? So all of that is connected and tells us a lot about what's going on. Okay, this is something I love to talk about because this is a way that we talk to teens and actually all patients about boosting serotonin levels. And we talk about the 6 S's. Sometimes we do the 5 S's, but I think service is a huge one. That always boosts how we feel, right? It helps the person, but it also helps ourselves. So we say sleep, sweat, sun, stoke, and social. So our feel-good chemicals, this boosts not only our serotonin, but our dopamine, getting enough sleep. Early morning light is a huge one that would go under the sun and the sleep. If we can get out of bed and get some of that early morning light, about 10 minutes, read a book out there, or if eat your breakfast outside, go on a walk. That actually helps set our sleep cycle because when we go outside and get that morning light, it stops melatonin production, which is making us tired, and it increases our cortisol, not to like levels of crazy stress, but enough to wake us up. We need cortisol in the morning. So that can be really helpful. And I love teaching that. And then to get other endorphins, exercise or the sweat factor, getting a massage, dark chocolate. Um, all of these things, getting in the sun that helps us get our vitamin D. And I just spoke about that why we draw lab work. Something I love to explain is that in Utah, especially, our vitamin D levels are usually deficient, not just low, but we have none. If we don't have any of that, then it actually makes us feel so tired and it makes our joints, they can ache. And I've seen patients that were literally laying on the couch and their parents would say they just are so tired they can't get up and they thought it was major depressive disorder. Really, when I draw labs, their vitamin D is in the teens, 19, 17. It's supposed to be 30 to 100. In Utah, we just don't absorb it the same. It's not that we don't get enough sun. We have a sunny summer. We have a great summer, but where we are geographically, we don't absorb it the same. And so about 75% of Utahns are low. So if you guys are feeling tired or achy, go get your blood drawn and see if your vitamin D level's low. And then stoke. So that's just, what are you excited about? What are you looking forward to? When we have something to look forward to, it can boost our excitement. Sometimes it's even better than the actual event. Think Christmas. I think the time going up to it just makes me feel like I'm on a high. I love it. So, and then social, having those connections. We need hugs. We need a good chat, a good laugh. All of that just boosts our feel-good hormones. So that can be good. And I love teaching all of those. So this is kind of where I was heading in the different categories: our dopamine, our oxytocin, our serotonin, and endorphins. So we often say, are you getting your daily dose? And so, as I said, dopamine is back to those 6 or 5 S's, the getting enough sleep, getting morning light. Endorphins is exercise. That boosts, dopamine as well. That decreases anxiety. Getting a massage, eating dark chocolate even boosts our endorphins. And serotonin is easily boosted by bright light or sun exposure, walking. So for those that think it has to be like intense exercise all the time, walking can be so beneficial, especially for those that feel anxious and feel like they can't, get into that. And then oxytocin is the hugging, complimenting someone makes them feel good, but also you, and playing with your pet or snuggling your pet. So it can be really beneficial. And then I am also passionate. I teach a lot of little tips that are research based on social media, on Instagram, and I love teaching about movement. Why I do that is to help people that are looking for little ways to incorporate a mood boost, or if they feel like they can't even come in for treatment, like what can I do now to help me feel or help my teen feel less anxious? If a parent can get their teen to go on a walk, I teach them to move the chemical. That's what we say at LEVO, or move for mental health. I always say, before you choose your mood or before you choose that you're anxious for the day, choose to move. I'll say that again. Before you choose your mood, choose to move, because you're moving the chemical, you're moving those endorphins, you're moving that dopamine and serotonin and boosting your mood and decreasing anxiety. And what an easy way to do that. And I like to teach, the reason I say movement a lot instead of exercise is because exercise, I work with eating disorder patients and a lot of other patients, but that is one of the things I'm passionate about. And so exercise has a really negative connotation for a lot of people, not even those with an eating disorder, just in society. We have such a society focused on think skinny, and body should be a certain shape, and it's just not true and not healthy. So I love teaching that movement can be anything. It can be gardening, it can be even housework, vacuuming, whatever you like to do that, because if you buy a gym pass and you hate the gym, you're not going to move at all. And the benefits of exercise are just huge, and movement. So I said exercise there, but and I like to teach people to move to change your mood, not to change something physically about you, because people get so hung up on, well, if I just walk, then I'm not gonna look this way, or I'm not gonna drop the pounds I want. I'm like, let's not think about that. Let's think strong, not skinny. There's so many benefits for thinking that way. And so often parents are like, well, I can't get my teen to go do anything. They don't have anything they're interested in. So I like to say it's always better with a friend or a buddy, right? So if the parent and teen have a good relationship, go on a walk. That side by side talking, instead of being face to face for some difficult topics, you can have some really good conversations on a nice walk or a nice bike ride if you're biking side by side. But um go shoot some hoops, then that takes the pressure off as well, and can really build relationships, decrease some of that stress, and get their anxiety down. But often you need to go and start it, right? You can't just be inside on the couch and say go move, like you'll feel better. Maybe get up and go with them. They learn a lot from example and from having a friend or a buddy, right? A parent. um Are there any questions yet on any of that? I can't see the chat, but if there's anything in there, let me know.
Yeah, there was a question early on,
Okay.
just in regards to the QB test, the
Yes.
system for young teens. Can that
Uh-huh.
also be applied to adult ADHD
Yes,
testing?
that is a good question. It is age 6, up to, we say, 70. I think that's the oldest that we've done. I think they say you can go older than that. Yes, so absolutely. We do children through adult to look at that, which is helpful. Um, I know this isn't on anxiety, but on the point that girls get missed, it wasn't studied early on, ADHD it was studied in boys in the 70s. And so the women, as many of you know, were missed, the girls. And so a lot of women come in saying, I think I have anxiety, like I can't manage my household. What is going on? Or they think they have ADHD, and sometimes it is just anxiety, and sometimes it's untreated ADHD. So good question. Is that the only one, Joseph?
Yeah, it looks like it. I mean, there was
Hey,
one question earlier about like the six S's.
oh yeah, yeah.
I think someone just had missed, the last two, but I think they got them. The chat
Hey,
kind of jot.
yeah. So they are sleep, sweat, sun, stoke, which I know sounds funny, but that's just looking forward to something, social, connection, and then service. So those are the six.
Great. One other question in the chat here. Is there any research comparing now to 10, 20, 30 years ago?
In anxiety,
I believe that's what Chuck is asking.
okay. I mean, they do know that the problem is there's a lot of factors, and so they do see a trend that it is rising. And I know you guys have all heard because, phones are such a buzz and social media, and we had COVID. So what is the factor? But I think all combined, and also are people getting more comfortable talking about it and coming in for therapy or for medication? So is that why the numbers seem higher? There is research, but it's hard to pinpoint the one thing that might be affecting the increase. But those are definitely things they point to saying why there has been the rise. I mean, it's just huge, and they know all of those play a big piece. And the thing is with I don't know if I'm sure many of you have read The Anxious Generation, but there's also um oh, there's also a book called Glow Kids. I couldn't think of it. Glow Kids, and it talks about screen addiction and just the difficulty of what that does, and the teenage brain isn't ready for that. Even as an adult, even for myself, I have to have reminders and time limits and things set, and even still, sometimes it's hard to get off the device, and so it's really important to talk about with teens especially because they are not built yet to handle that. Their brain is just making so many changes and connections. Um, okay, so a lot of our serotonin is housed in our gut. And so, we feel it in our gut when we get anxiety. A lot of people get what they say butterflies, or their stomach hurts, or they might have to run to the bathroom, or they might feel nauseous and sick. And so really taking care of our gut health is important. So nutrition is a huge thing that I love to talk about. So a lot of things that are good for the gut, I've already, touched on vitamin D and how most people are deficient. And then omega-3s, those are found in nuts and flaxseed and chia seeds. And the reason why I hesitate to dive into this too deep is because this is also a thing that is huge and that has been tainted by society and by the culture to be thin. It just makes me sad because then people don't even know where to start because there's so many angles and supplements recommended and things like that. So I always like to say, take it back to the basics. That is what's best. If someone claims something is doing something fantastic and they have these great results, well, you should dive deeper and see where the research is and see if they're selling a product because maybe the research was done in their own lab so that they can benefit. So just always question where you're getting your information. And so we need, like I said, the omega-3s are so beneficial, folate or B9. We need that for the synthesis of norepinephrine, serotonin, and dopamine. It really is the basics that help make us feel our best, and this helps decrease anxiety and increase mood. So it's so beneficial. One thing I wanted to talk about on folic acid and folate is on the gene site test that I mentioned, there is a second part of the test that is just part of it with not a we don't charge for the test, we just use it through a different company. So I'm not like selling that, but I am just so pro because it has a test that looks at the MTHFR gene mutation. And why that is beneficial is because that looks at how people's body metabolize folic acid. And if we can't break it down, we're making less serotonin because that's eventually what it gets broken down to. So what the test comes back as the results, there is a red category, yellow, and green. Green means you metabolize it great and you have no issues. Then yellow, it's a little bit less, and red, you're not really metabolizing the folic acid to serotonin at all. So there's an easy fix to that. It's a B vitamin, a methylated B vitamin. So there's just all these little things, and that's what comes back to the title of this presentation is building a scaffold for teens to help with their anxiety, because there's not one thing, in my opinion, that will be a cure-all. I love recommending therapy. We don't do traditional hour-long therapy at LEVO. So I tell everyone, get a therapist, go to therapy, because that gets to the root and gets coping skills going. I also talk about all the other things, the nutrition, the sleep, the movement, because all of it is a piece that builds this scaffold to help lift and make someone feel better. And it not only helps them now when they're a teen, it helps them throughout their life. And this sounds deep, but for generations to come, they are taking care of things for them. They're going to have better relationships, yeah, feel better and be able to lift those that come in the future. So it's pretty powerful. Um, some other things that are so great for our gut and mental health are turmeric, however you say it, and then magnesium and fiber. Those things are really beneficial. Now, magnesium, I want to really focus on. That's found in avocado, beans, and pumpkin seeds. So sometimes people are like, how do I even incorporate this into my diet? I hate avocados. Well, black beans, we have Taco Tuesday at my house every Tuesday just because there are so many power-packed things in tacos. So those that love that kind of food, you're doing something right, because there's a lot of good things. So magnesium regulates the neurotransmitters and calms our nervous system. It has over 800 functions. So man, if we can get our magnesium in and encourage teens to have a little bit more than chips and candy and soda, then that's beneficial. Now, as someone that works with eating disorder patients, I don't say don't have that stuff, because that causes issues as well. When we restrict, it just makes us want that more. Our body is just, that's all our brain can think about. So I like to say, what can we add in? You can have the chips and the soda, but that's not really a complete meal. So what can we add in that can keep us full longer and support our brain health and really calm us down and lift our mood? Food is powerful. And then fiber is just really great in fruit, vegetables, chia seeds again. These little things help keep us full longer and just help keep the microbiome healthy, which keeps our gut healthy. So, like I said, there is the scaffold. And so part of that scaffold and what I do is educate on medication for anxiety. Why this is important is because we're very conservative on medication. And when it's needed, it can be beneficial, but it's not always a piece of the scaffold. To be honest, sometimes every medication makes someone feel worse, and we just stick with behavioral techniques and the diet and movement and therapy. But the reason I like to talk about these is because those that are seeing you, if it's for school counseling or for therapy, meds might come up like, yeah, I'm on something, I feel terrible. That's important to talk with providers. So reach out to their provider and find out what's going on. We love to collaborate and really talk and hear what's going on and if they're having side effects or if it's not working at all. So there's a few different options. Now, this is not the complete list. There's other ones that we will try, even ones that are more off-label, but are very effective. So SSRIs, which people are very familiar with, are those selective serotonin reuptake inhibitors. Those are Prozac, Zoloft are the brand names that you've heard, Lexapro. those are not all created equal. If someone comes to you, and I know everyone has to stay in their lane, right? School counselors can't say, oh, you should go get on meds. They have to stay in their lane. Um, Therapists can't say, you should try this SSRI. But just having a little base of education on things and knowing if they say, oh, I tried Prozac and it was terrible, so I'm not trying any other meds for anxiety, they're not going to help. Well, there's so many options. And so there could be other things that could be really beneficial. So that's what makes me sad is when there's one that didn't work and they shut out all other options. And I know it can be scary to try, yeah, to put something in your body that you're like, what is this going to do? Um, but I do love that they are not all created equal, and some of them are more calming for those with higher anxiety. And then some are more activating, like Prozac is a little more activating for those that might not be able to get out of bed. So there's different uses for them, even though they're in the same category, and boost that serotonin for mood and to decrease anxiety. Another category is an SNRI, serotonin norepinephrine reuptake inhibitor. So those are Effexor and Cymbalta. And so I'm sure you've heard of those. I I love Cymbalta a lot. That's a very calming medication. Now, with the added norepinephrine, it can be a little activating, and we don't want to activate someone too much that has anxiety because that makes it worse, right? And that's another thing with ADHD and anxiety together is that if they're on a stimulant, often those make people feel anxious, not all the time. Sometimes it calms anxiety, but if they're feeling anxious on that, there's other options than a stimulant. They don't have to be on a controlled stimulant to get relief. So, another category is alpha 2 adrenergics. These actually were meds that kind of came across to treat ADHD and anxiety by accident. They are heart medications. And we use guanfacine all the time and clonidine for kids and teens because it's calming. And we use it for tics, we use it for anxiety, insomnia, and focus. They are like a 3-in-1 triple threat medication with minimal side effects. And so those can be really beneficial if they're having behavioral troubles or just need to kind of rein it in, or those that are having trouble sleeping and anxiety about going to school or about making friends, meeting new people, that can be helpful. Then we also have this category often makes people very nervous when we bring up if they've tried other ones and they haven't responded well, is the second generation antipsychotics. So maybe you're familiar with olanzapine or Zyprexa or quetiapine or Seroquel. So the word antipsychotic can really make people nervous, but at low doses, we're getting up to really high doses in quetiapine. We get up to 600, 800 milligrams. But at the low doses, I'm talking baby doses of 25 or 50, that can help calm someone's nervous system down. Though both of those do make someone tired. And so we give them at night usually. And they can be so beneficial. The reason I like medication, we never give medication and say, okay, you're good, and send them out the door. We always do a little bit of teaching with the appointment so that they can get even a little coping skill if they're not ready to go to traditional therapy. But I also love that if you can calm some of the anxiety down, research shows that the combo of therapy plus medication, you get the best results. There's better response rates, longer remission, and better outcomes. And so that's why medication can have a powerful place. I know the stigma is still higher than therapy. I feel like people are more open to going to therapy than taking medication, but sometimes the combo is needed and can be really beneficial. So I love teaching that. And I say that on this next slide. Evidence from clinical trials suggests that augmentation of pharmacotherapy using CBT or other, modalities may be effective in treating pediatric anxiety disorders and teen disorders with the combination of medication and CBT, and it has greater treatment response than either of those things on their own. So we do try and get everyone to get on board with therapy. And usually people come around. Sometimes it takes like a year and they're like, no, I'm good with the medication, but we do try to encourage that. So that's all that I have because I did want to leave some time for questions. Um, Hopefully some of that was helpful, but thanks for listening to all of that. I know it's a big topic.
Yeah, we do have a couple questions in the chat. Someone asked, what kind of magnesium is recommended? I think
Okay,
it,
that's
when we're talking about dietary issues and things like that.
yeah, that is such a good question. I know when people, there's one, and I don't have any affiliation with this because there's magnesium threonate, and that's given a lot for menopause and things like that. And so there's magnesium glycinate. And so there's magnesium citrate. There's one that has a combo. Um, the magnesium, they're all calming. So really there's one, I wish I had which one it was, but there's one on Amazon. I can send it actually, maybe Joseph, and you could send it out when you send my slides so you guys would have that.
Of course.
But it has a combination of a lot of them, and that's what I like because it covers calming, it helps cognition, which is thinking, it's calming to so many parts of our brain and body. And so I don't have a specific just one, which is good, but that's why I like this one because it has a combination of several. So I hope that helps, but I'll send that to Joseph so you guys have that.
Great. Another question. How long does it take for an SSRI or one of those other anxiety medications to be in full effect?
That is such a good question and important because that's another factor on if they give up too early. So they take a while. So they take, for full effectiveness, about 8 weeks. Now, I'm not saying there's some magic number at 8 weeks where they say, um, oh, I feel so much better. Everything's great. People can have some benefit in about 2 weeks. I like to educate that with about 2 weeks, side effects go down if they can hang on. Now, I'm not talking serious side effects like suicidal ideation. They're miserable. They have migraine every day. I'm saying, some nausea, maybe their sleep is a little off. If they can hang in there for about 2 weeks, that's when the benefit starts to take off at about that time. And then if they can stay on it for about 6 weeks at a therapeutic dose also, what dose were people on? If they say it didn't work, that's about how long it takes. And so it is a while. Oh, and then I got into the chat, Joseph, so you don't have to read them all, luckily. So someone said generally 3 weeks to start working, 6 weeks to hit full effect. Yeah, so that's 6 to 8 week mark. And then, oh, Chuck said the 10, 20, 30-year question was comparing anxiety and dysfunction now, oh, to pre-cell phone to more rural lifestyle from the past. I love that. So, yeah, like I said, there's so many factors, but for sure it has been a factor. It's a problem, and I see that, and we actually assess phone use, tech use. Are they sleeping with their phone right by their bed? Studies show that having the phone just even in another room, you sleep better. So um, I try to do that practice. It's hard for me because I have a daughter with type 1 diabetes, so I need to hear her alarm if it goes off. But if you can do that, I have it across the room instead of kids needing their notifications. And when people are like, my music is on there, my alarm is on there, I say, here's an alarm on Amazon, get a new alarm. That's, the old school kind that a lot of us had. And I also say, if you need music, you can have it, but maybe across the room, or get a, old fashioned some way to play some music. There are alternatives, even though I know it's not as convenient, but an Alexa is a newer one that could work. Um, and then Jessica asked, is there a multivitamin you recommend for teens that has the vitamin D and other essential vitamins teens are lacking? That's a good question. I just recommend there's not one brand I recommend. There is a brand on, I mean, to be honest, because cost is a factor, right? And so I hate when people, and a lot of people, finances are tough. And so I don't want to like send people down this expensive path of all these supplements. But I do think a multivitamin is a great idea. One thing you want to look for when someone takes vitamin D, taking vitamin K with it helps it absorb better. So I haven't found a multivitamin with both of those. If you do, that's amazing because I have to buy my vitamin D and vitamin K separately. I don't know why more don't include both, but the vitamin K helps you absorb it better. And why wouldn't we want that better absorption, right? And then, so I always recommend that for teens. Magnesium is a big one. They can talk with pediatricians about, if they have a specific, I always ask the pediatrician if they have a route just so we can collaborate of, of what exactly they want. And other than that, and what I've read is just a multivitamin you can get at Costco, like if they need a gummy or, just to kind of keep costs down, it does add up. The magnesium one that I'm gonna send to Joseph is about 30 bucks. I try to make it last a little longer than a month, but it adds up for people. So I try to take that into consideration. Oh, and someone said I send them to get a prenatal at the pharmacy and then add magnesium and omega-3. That's a great idea. Yeah, and you taking a prenatal is a great thing because it incorporates so much. Are there medications for anxiety during pregnancy, breastfeeding for adolescents? Yeah, there's a lot of research. They haven't researched just teens, but there's a lot of research on the SSRIs. And actually, this is one point I love driving home is that the old practice and what people were taught is, oh, if you're pregnant, stop all medications because that is going to be harmful for the baby, especially in the first trimester. Now, there's a couple that we actually just kind of stay away from if anyone, for any woman, any that can have any chance of getting pregnant. Depakote is one. It's a great mood stabilizer, not for anxiety, but most for anxiety. We say the untreated mental health condition can be more damaging to not only mom, but the growing baby. And so if they have found something that is effective and works, then we often will stay on that same thing. Now, if they're stable and doing okay, sometimes we do taper down to see how they do. But if they're doing well, it can be really risky to mess with that. So there are a lot of good options. Not all of the antidepressants are okay for that, but I know Zoloft, it doesn't get into much of the breast milk and pass through. And then, yeah, there's a lot of studies on Lexapro, Zoloft, Prozac, which is great. So there's a lot of good options. With the guanfacine, if they were on guanfacine and clonidine, they would have to talk with their OB about that one because the blood pressure with those, the blood pressure can go down some on the mom, so that one is one. Some are less studied than others. Let's see. Are the vitamin recommendations the same for teen boys and teen girls? I am not 100% sure. I do know that the vitamin D is the same and the vitamin K. As for taking a prenatal, obviously that has different things, so that would be recommended for the girl. But I'm not for sure on like a teen boy, but just a multivitamin, because I do think, and getting that lab work done, seeing if their vitamin B levels in a good range, and if their iron stores are good. Iron, I don't usually prescribe, but we'll send them back to their primary care or pediatrician so that they can keep monitoring. But if we find it's low, that can make people really tired as well, as I'm sure you are aware. Oh yeah, and then someone just said Lexapro and Zoloft are generally thought to be safe during pregnancy. Yes. And so that myth of getting off those meds is just kind of old thinking. You still have to, read the research on all the meds, but they want to keep mom stable. And that's all the questions I have in here. Oh, so the next question is, what class is Wellbutrin in? That is a really good, that's a really good question. And what is important is that that one, although it's tricky, it can help with anxiety, but um, it can also make anxiety worse. So we have to be really careful. And so that one works on norepinephrine and dopamine. That's why we give it a lot for ADHD. I'm not saying it can't help with anxiety, but yeah, if someone's on it and they start to feel like more activated, we just stop it because some people do go well, but that's the class is an NDRI. So it is in the class of antidepressant, but it works a little bit different neurotransmitters. So that can be really effective for smoking cessation, ADHD, and depression and anxiety in some. Some just are too sensitive to it. So good question. Any others? We have a few more minutes if there's any other questions. These are great. I'm making sure I didn't miss any. Is there a difference between vitamin K1 and vitamin K2? I actually will have to look into that. I don't know that for sure. The one that I usually see with the vitamin, well, actually, I've seen both. So I love that question because I don't know off the top of my head. But I'll get some research and send that on over to Joseph.
Awesome. Any other questions before we end today?
Oh, what about ketamine treatments? Are they approved for teens? I've seen a lot of success in adult clients. Yeah, that would be off label, off the FDA approval. So there's a lot of stuff up and coming with those types of treatments. So yeah, we'll keep watching for that. Good question. And yes, ketamine treatments can be very helpful for adults 18 and up at this time.
What about vitamin K with warfarin? Is the question from Shirley.
Vitamin K with warfarin, they mean like taking it together?
I believe so, because if I'm not mistaken, warfarin's a blood thinner.
Yeah, so that's a good question. Also, with fish oil, which I didn't even touch on that yet, um, um, they would just need to look at dose of warfarin, and talk with their their primary care provider, because the ins and outs of that, just to make sure dosing would be okay, because I know that if it was a lot of vitamin K, that could be an issue. Fish oil is so great for brain health. I tell everyone to take that as well. And that at higher doses can be a blood thinner. And so it's recommended like before surgery to come off of the fish oil. So yeah, looking into that and dosing, of the warfarin and how much vitamin K, how often would be important to ask. Good question. Thanks, everybody, so much.
Thank you for joining us today, Andrea. This has been
My
very
pleasure.
educational. We
Yeah.
appreciate the time and the preparation that you put into this presentation. It was amazing. We're getting a lot of good feedback here in the chat, as you can see.
Yeah. Thanks, everyone. You're so nice. It was my pleasure.
Great. And if you have additional questions or anything else that comes up, please reach out to me. I'm happy to communicate those with Andrea and we'll get answers for you.
Thank you.
Enjoy the rest of your day.